We present a 3D video of the microsurgical resection of 2 micro-AVMs of the corpus callosum. Our patient is a boy under 12 years old who presented with a sudden onset thunderclap headache and loss of consciousness. Initial CT showed an intraventricular hemorrhage with associated hydrocephalus. This was managed by external ventricular drains. The patient recovered from the acute episode with no residual focal neurological deficits. Subsequent MRI and DSA identified 2 micro-AVM nidi in the body and isthmus of the corpus callosum. Both were supplied by branches of the pericallosal artery. The splenial nidus drained into the straight sinus, whilst the more anterior nidus drained into the inferior sagittal sinus. Neurological examination found no focal deficits, but detailed neurophysiological assessment and masked moderate to severe impairment of arithmetic and visio-construction. Given the high risk of hemorrhage in this age group, intervention was recommended, with microsurgery felt to offer a definitive and instantaneous cure. Surgery was planned using anatomical landmarks. The patient was placed in a prone position and a left interhemispheric approach was performed. Neuronavigation, motor evoked potentials, and ICG angiography were used as adjuncts to the surgery. After performing a midline craniotomy, we began dissection to reach the cistern of the interhemispheric fissure using microscissors. We continued the calcotomy at the level of the body of the corpus callosum, where we identified both pericallosal arteries. We opened the corpus callosum and released cerebrospinal fluid. At this point, we could see the abnormal vessels of the arteriovenous malformation. We dissected, coagulated, and cut them sequentially. Indocyanine angiography was then performed, which showed shunting into the draining vein. This was protected as we continued to disconnect the remaining feeder vessels. The draining vein was then